Hey everybody, it's Dr. Ballard. This segment we're talking about lower leg injuries, overuse injuries, and what you guys have probably heard as shin splints. So when we talk about shin splints, it's a term that's overused. It doesn't specify specifically what we're trying to identify as the cause of the injury. So as a provider, what we're trying to figure out is what tissue is involved, why is that tissue involved, and how can we better correct it from happening in the future. And typically what we'll see is a tendinopathy or a tendinitis or a muscle strain where the muscle and the tendon are becoming overworked. Commonly you'll see the inside of the lower leg right along that shin bone, so that flat bone right on the inside, that's a common spot. And then on the outer portion, outer front is another common spot. So those are the two main areas. And what you're trying to identify is, does it come on with activity? Is it specific to a specific activity? Is it something where you notice that your impact increases or the mileage increases, it comes on? Or is it something that it's there, maybe it warms up and goes away, and then later as you hit higher mileages or more demand, then it comes back? And typically that's what a shin splint will feel like. It might warm up and feel better to a point, and then it comes back, whereas something that's more severe, more of a concern for a provider would be compartment syndrome, where you're doing pretty good, you hit a point, and then symptoms come on and they stay, but then they get worse and worse and worse. And what compartment syndrome is, it's a fullness, it's a swelling that occurs where these compartments in the lower leg that hold muscles, tendons, nerves, they become so compressed with circulation that they can cause compression down into the foot, where you lose the ability to lift your foot. You'll feel that fullness, that swelling, the foot feels heavy, foot goes numb. In most cases, these are medical emergencies. You want to stop the activity and make sure you don't get to a point where you're losing that strength, because now we know the nerve is seriously being impacted, okay? So we're not talking about that today, we're talking about the tendinopathy overuse, all right? So if you have a lacrosse ball, you can take your lacrosse ball and, just like we talked about, these two specific areas, drop right off the side of the shin bone, and just nice and controlled, work your way down, let the ball dig into those tissues, find any areas that are tender. If they're overly tender, you can pin that spot, pump the foot up and down, work your way down to about 1.5 inches above the ankle bone, work your way up, and then switch sides and hit the other side, and same thing, you're just pulling the ball into the muscle, working your way down, work your way down. If it's tender, pin that spot, pump up and down. Spend about a minute on each side and then retest. Stand, move around, see how it feels. It should feel lighter, it should feel better. A lot of this will feel good immediately, but what we need to kind of back it up with is some kind of activation exercise to now train that muscle to be able to withstand the stress of training. And that's a common spot that's missed, is just treating, just massaging, just stretching. That's typically not good enough. We actually need to let the tissues adapt to the demands, okay? So this next drill is going to be done in standing. You can take your shoes off for this. I'm going to move this out of the way. So if I'm standing, first of all, I'm standing with my feet straight. I should have a little bit of a gap between the inside of my foot and the ground. If you look down and you notice one that either your foot's collapsing, or if your natural stance is something like this and your feet are going to naturally collapse, we need to try to work on correcting that, because this position leaves the knee wide open for an injury. It causes a lot of stress in the hip, the back. If I were running in any type of speed in this position, a lot of this stress is gonna work its way up into the knee. It's gonna cause this to kick in right away. So you could spend all the time in the world doing the corrective work, but if you go back into a dysfunctional position or a suboptimal position, you're ultimately going to have the same issue, okay? So feet are forward. We're going to straighten the knees. We're not going to lock them. We're just going to straighten them. Hips are going to be stacked right underneath my shoulders. And all I'm going to do is just twist my leg out and then bring it back in. So I'm twisting the leg without letting the foot move. And by doing this, I'm working that inside muscle part of the lower leg that we just worked with the lacrosse ball. And this is a muscle that winds its way down into the bottom of the foot and stabilizes the foot during high impact activity. So if I'm twisting, I'm going to feel a little bit of fatigue kick in. It doesn't happen right away. You have to work up into the 40 to 50 reps range. But once you get to about 25, 30, you really start to feel it, and you'll feel it here too as well, which is really good because it's just training those stabilizers in the hip.